Well, good morning, everyone. Thank you for coming to our webinar this morning. I want to thank St. Clair, St. Mary's, and St. Michael's for hosting this event. Many of you have probably gotten this book in the mail, and you probably find it very confusing. When my mother-in-law got this book, the first call was to me. Jimmy, I don't understand this thing. Please help me out with this. So maybe many of you feel the same. So today we're going to talk about Medicare. We're going to do a Medicare 101. So you'll be very familiar with how it works. So let's get started. Who is eligible? Persons that are under 65 and have certain disabilities. So if you're on Social Security disability, you have to be on it for 24 months before you can receive Part A and Part B. Persons that have end-stage renal disease. Now, if you are a U.S. citizen and age 65 or older, and you have been a permanent resident residing here for 5 consecutive years. Some beneficiaries are dual eligible, so that means you'll have both Medicare and Medicaid, and that is based on income. Now, it's important to know this. Persons who have worked for 40 quarters, so you have to work for 10 years. If you've worked for 10 years, you will not have a premium on your Part A. That'll be free just because you worked. Now, if you have worked fewer than 40 quarters, then you could have a premium as high as $458 for your Part A. That's entirely possible to happen. Now, if that does happen to you, you still can go out and get a job and work that other quarter, and then they can reduce that to make that a zero premium for you. So just keep that in the back of your mind. If when you go to qualify for Medicare, if you do have a premium for Part A, they'll tell you how many quarters you work, and you can maybe get another job if you're able to get the quarters that are required. Okay? If you do not qualify on your own, then you may still be eligible based on your spouse's work history. So that's something you have to look at as well. What happened there? Okay. Medicare options. The important part of this slide here is to look at the top where it says Medicare Part A and Part B. You have to have Medicare Part A and Part B in order to get a Medicare Advantage plan or to get a Medicare supplement and a prescription drug card. One thing we're going to find when we're talking about Medicare, it can be confusing because they'll use multiple names for the same thing. I'll give you an example. Where it says Medicare Advantage there under number 2, well, that's also called MAPD, and it's also called Part C. It means the exact same thing. Medicare supplements under number 3. You may have heard them called Medigap plans. Again, they are the same thing. So we're going to go over this in more detail in a little bit, but I just wanted you to be aware that you want to make sure you have Part A and Part B in order to get any of these plans. Now, there are 4 parts of Medicare, and this is where it gets confusing as well. So let's talk about this some. Part A. Part A you generally get without a premium because you have worked. Now, this is your hospital coverage. So Part A will be your hospital coverage. It does have deductibles and coinsurance. So if you should go in the hospital for one day on Part A, in 2020 you'll have a deductible of $1,408. Now, Part B is for your doctors. So this is when you go to your doctor for a checkup, when you go to your specialists. Part B for 2020 has a deductible of $198. So you have to pay that deductible before you're going to get any benefit from Medicare. Now, included in Part B, you'll have a premium that you have to pay for Part B. Part B's premium for 2020 is $144.60. Now, that's also an income-rated premium. Depending on how much money you make, they can actually adjust your premium for Part B. We'll get into that a little bit later as well. Part C, Medicare Advantage plans. Remember I said earlier, there were under Medicare Advantage plans, they could be called Part C, Medicare Advantage, or Medicare MAPDs. Oh, where'd you go? There we go. Now this combines both Part A and Part B and usually includes a prescription drug card. So you have all of your coverage with one card. We're going to get more involved in that in a little bit as well. Part D are prescription drugs. These are also called standalone prescription drug cards, or PDPs. You can have just Medicare, Part A and Part B, and then get a prescription drug card as well. You can do that. Now, items not covered by Medicare: deductibles, co-insurance, and co-pays. Now, the difference between co-insurance and co-pays are this. If you have co-insurance, it's usually 20%. It's a percentage of the bill you have to pay. A co-payment is a designated dollar amount that you would have to pay. Maybe you pay $10 when you go to the doctor, or $20 when you go. That is a copay. Another thing not covered is outpatient prescription drugs. Medicare does not cover outpatient prescription drugs. That's why you have to buy a standalone prescription drug card, or Part D. Healthcare outside the United States. Hearing aids, exams, and screenings are not covered by them, or nor is routine eye exams and glasses. Part D coverage. Now, we need to spend a little time here because this is where it can cost you a lot of money if we don't make the right decisions. Okay. Drug coverage must be obtained through a Medicare health plan, and with drug coverage included, or through a standalone prescription drug card. So, you can get a Medicare Advantage plan that has prescription drug coverage in it, or you can buy a standalone prescription drug card. You cannot have both, one or the other. Prescription drug coverage is available to everybody with Medicare. Each Part D plan is different based on the cost, formulary, and covered drugs. I want to stop for a minute and talk about that. It's very important when you are trying to decide on either a prescription drug card or a Medicare Advantage plan that you must look at the formulary for that particular card or Advantage plan to make sure your drugs are on there and how they are covered. And you must do that with each one. The reason being is drugs will be different tiers on each of those formularies. So you can't assume that you saw it on one, it's a 2, and every other company is going to be a 2. Okay, so it's very important that you do that. Part D, late enrollment penalty. Okay, now with this, what this tells us that is if you choose not to enroll in Part D when you're first eligible, so let's say you just turned 65 years old, you got Part A without a premium simply because you worked, now you got Part B and you're paying for that. But you say, hey, I'm healthy, I'm not taking any drugs, I'm not going to get a drug card. Okay? This is where a penalty can come in. Now all of a sudden you turn 70 years old, 5 years later, you're starting to take drugs, you go, I'm going to go get a drug card now because I'm taking drugs. Well, here's where we can get in trouble. Because if you choose not to enroll in a Part D when you are first eligible, then you will likely pay a late enrollment penalty for each month that you did not have credible coverage. The penalty is 1% of the national base beneficiary premium. Every month you could have had prescription drug coverage and chose not to enroll. The late enrollments, now that's if you haven't been covered for 63 days or more, and the national premium right now is $33.06. So here's how it works. If you took those 5 years that you didn't have coverage in that example we talked about earlier, then they would say, okay, you didn't have coverage for those 5 years, we're going to charge you 60 months worth of 1% of the $33.06. And that penalty, which is roughly 33 cents, times 60 months, is going to be assessed to you for the rest of your life. It's not a one-time penalty. It's not just a year penalty. It's the rest of your life. So it's important to know that because this is where we can lose a lot of money. It can be very expensive here. Part D terms. Formularies. We talked about this just briefly. So formulary is nothing more than a list of prescription drugs that particular company covers. Now, you need to check your drugs on every formulary that you're thinking about possibly joining. Tiers. This is where they're assigned to drugs. Tiers 1 through 5 generally. This year there are some tier 6s, but generally tier 1 through 5. So copays could be $0, $2, $5, $10. Again, we have to look at each particular plan to see what copay is assigned to what tier. Usually the more expensive drugs are going to be a higher tier, and you'll find a higher copay with them. Mail order. A lot of people like this option because they can just get their drugs right through the mail, sent directly to the house, and usually it's at a discounted rate. Normally you'll get a 3-month supply for 2 months of copay. Copays on this, that's your share of the cost of the prescription. So if you have a tier 1 drug, as an example, and in that particular plan, it has a 0 copay for a tier 1 drug, you'll pay nothing for it. On another plan, if that same drug is tier 1, but that plan has a $2 copay for it, then you'll pay $2 for it. Now, step therapy. In some cases, health plans require a member to try more cost-efficient alternative drugs before covering another drug for that condition. So they may have you try lesser expensive drugs before they give you the more expensive name brand drugs. That's very common. Medication therapy. This one here, if you take medications for different medical conditions, you may be eligible to volunteer to get services at no cost to you through a Medicare therapy management program. MTM helps you and your doctors monitor your health needs to make sure your medications are improving your health. You'll receive comprehensive reviews of all of your medications, and this review will detail the full list of prescriptions you're taking. So this, when they're doing this, they're really trying to hone in on the medications that are really doing well for you. Part D, important information as well. Okay, we talked a little bit earlier about if you have higher income. So if you have a higher income, the law requires an adjusted for both Part B and your monthly prescription drug coverage. So in 2020, the dollar amount is, you can make up to $87,000 as an individual and $174,000 as a married couple or filing jointly. If you make more than that, then they can increase your Part B premium. So instead of paying the $144.60, you could pay more, depending on how much money you make. We have an actual chart for that, and when we get more into that, we can actually get that to you if you need it. You must live in the service area of your plan you would like to join. Again, that's important. You got to make sure that the plans you're looking at are in your area. Many times we hear, hey, I have a friend in Florida or in another state or even another county in the same state that has this plan. That plan may not be available where you're at. So you have to look at the plans that are available in your area. A network pharmacy. Where you buy your drugs is very important because each prescription drug card or Medicare Advantage company could have preferred pharmacies. So if you use a standard pharmacy instead of their preferred pharmacy, you could pay higher copays. So when you're looking through this, you want to make sure that the pharmacy you use is a preferred pharmacy with a carrier that you want to go with. Because the idea is we want to save as much money as we possibly can. Additional help may be available to lower your drug costs and protect against higher out-of-pocket expenses. There are some great programs out there that many people aren't even aware of. Through the state of New Jersey, a program called PAD. It doesn't cost you anything. It's an income-rated program, and it can save you a lot of money on your prescription drugs. So we can help you take care of all those things. Now, initial coverage limits. This is important to know, especially if you are coming from an employer type of plan where you're just used to say, hey, here's my insurance card, pick up your drugs and never have to worry about the cost of them. Well, in Medicare, there is a formula that they use, and all Medicare prescription drugs adhere to this formula. So the plan can have up to a $445 deductible in 2021. So what that means is that if your plan has a deductible and you have to go get drugs and they're not covered by that deductible, that means you got to pay the full price of that drug until that deductible is met. Now, once you've done that, now you become into what they call initial coverage. That's, okay, so that's step two. The amount paid by the beneficiary after the initial deductible is a copayment. Remember earlier we talked about tier 1, tier 2? So if you have a tier 1 drug and it's a $2 copay, then here is where you would pay the $2 copay. Okay? And if it's tier 3 and it's a $47 copay, that's where you would pay it, and so on. Now, under number 3, all Part D plans cover the first $4,130 for 2021. That's a good number to write down, and I'll tell you why. That's very confusing for a lot of people because they say, well, you know, Jim, I only have 3 prescription drugs and I only pay $2 for them each, so I'll never get there. Well, it's not just what you pay, it's also what the insurance company pays. So, for example, if that $2 drug is what you pay, but the insurance company pays $98 for it, they take $100 and put it towards that $4,130. Well, what if you have 7 of those drugs? Well, you're going to see in about 6 months, you're going to be in the donut hole. So it's important for you to realize how this works. Okay, so once you have reached the initial coverage limit, that $4,130, that's your combined copays, coinsurance with the total cost of the drug, then you fall into the coverage gap. Now what happens? All right, when you're in the coverage gap, you will receive discounts on both brand name drugs, and you'll generally pay no more than 25% for the brand name drugs and generic drugs until you reach your $6,550 for 2021. So let's back up a second. We know that when we paid the $2 for that one drug and the insurance company paid $98, we lumped that together and went towards the $4,130. Now we're going to pay 25% of that $100 drug. So that same drug just went from $2 to $25, right? So that's still $100 going towards that. So each time we spend that money and it goes towards that $6,550, that's what they're talking about here. Now, once you get to $6,550, you're in catastrophic coverage. Okay? Not everybody's going to get here. Some people won't even get to the donut hole. But it's possible, and it's important for you to know this so you can make sure that we're looking in the right drug, the right formularies to make sure you're paying the least amount for your drugs. Once you have spent the $6,550, again, this is for 2021. That's called your true out-of-pocket or TROOP. Again, they're using multiple names for the same thing for the year. You're out of the coverage gap, and you will then be automatically moved into catastrophic coverage. Once you're in catastrophic coverage, you will pay $3.70 or 5% of the cost of the drug. So it's $3.70 for drugs that cost up to $74, and then drugs over $74 would be 5%. Okay? For a brand name drug, it would be $9.20 for drugs that cost up to $184. Drugs over $184 would be 5%. So you can see how confusing that this can be. There's a lot of techniques that we can utilize with you and show you how to use to reduce your drug costs. There are programs out there that will help you. And again, we go over this many times with you so you have a very clear understanding of how this works. Now, extra help. Additional help paying for your prescriptions may be available. You may qualify for low-income subsidies. Again, if your income is low enough, you may also qualify for Medicaid. You may not qualify for Medicaid, but low-income subsidies that will help pay portions of your deductible, maybe your full deductible, maybe even your Part B premium. It all depends on what it is you qualify for. And again, we'll show you where to go for that. But here's a list right here where you can go and get this information. Okay? Oh, let's go back. What happened there? Medicare supplements. All right. We're going to spend a little bit of time on these next two categories coming up. One's going to be Medicare supplements, and the other is going to be Medicare Advantage plans. There's a lot of confusion here because when they hear supplements, they think they encompass both of them, but they do not. So what Medicare supplements are is this. Okay, the beneficiary has the freedom to go to any provider who accepts Medicare in the US. So you do not have to worry about a network. The only question you have to ask is, do you accept Medicare? If they say yes, then you can go there and use your Medicare supplement. Direct access to specialty doctors, no referrals. Monthly premiums are based on age and zip code, and rates will increase over time. These are the most expensive types of plans. Enrollment is based on underwriting. Now, there are certain times that it's a guaranteed issue, such as when you turn 65, you have an opportunity to get into these plans without any underwriting. Or maybe you were working after age 65 and you had credible coverage through your employer, and now you're going to retire and go get Part B. Again, that's another opportunity for you to get this particular program with no underwriting. Now, some copays are associated with original Medicare based on the selection. We'll talk about that momentarily. Beneficiaries must purchase a standalone prescription drug plan. Now, remember, Medicare does not cover prescription drugs. These plans help pay the 20% that Medicare does not. So we have to remember, Medicare is an 80-20 plan, and at no time does Medicare alone ever become 100% coverage. So that 20% will always be there for you throughout the time. Medicare supplements will pay that 20% in some form, and we'll show you that. Beneficiaries must purchase a standalone drug card. Limited value-added services must purchase dental and vision plans separately, okay? They do not come with dental and or vision. If foreign travel is needed, beneficiaries must purchase a Medicare supplement with that coverage. Many of them do have that. Those work very well. Maybe you're going to go on a cruise. I had this happen with a client. They did. They went on a cruise. They had to get airlifted because they got ill, and they were flown back to a hospital in the States. Well, what they did was they got receipts for all those charges. They sent it into the company, and they were reimbursed for those charges. So they're very benefit-rich plans. Now, these are the plans that you're normally going to see that have letters attached to them. You know, plans like Plan G, Plan N, maybe you've heard of Plan F, Plan C. Those are your Medicare supplements. They work directly with Medicare. So, give you an example. When you go into the hospital with Medicare alone, you have a deductible of $1,408 this year for the first day in the hospital. These plans pay that. You will not. Okay? That's just an example how they work. All right? Now, Medicare supplements work in this way as well. When you go to the doctor, here's how the billing works. The doctor will send that bill to Medicare. Medicare looks at that bill and goes, okay, we've got this bill from the doctor. Well, this client has a Medicare supplement, so now send the bill over to the Medicare supplement. So the doctor sends the bill to Medicare, the Medicare then sends it to the supplement. You don't get the bill once you've met your deductible. Now, Medicare Advantage, different plans. Medicare supplements, you have 3 cards. Your Medicare card, your supplement card, and your prescription drug card. With Medicare Advantage, you have 1 card. Because once you choose a Medicare Advantage plan, whatever company you chose is now going to be responsible for paying your health bills, okay, all of your bills for health. Now, these programs are guaranteed issue, except for end-stage renal disease. In a lot of cases, you got to select a primary care doctor. In a lot, you do not. Depends if it's a HMO that has no referrals or a PPO. We'll talk a little bit more about those in a minute. You may need a referral. A lot of them now are doing away with referrals. A lot of these programs have low or zero premium. So yes, you do have to have Part A and Part B to get either a Medicare supplement or a Medicare Advantage plan. But with a Medicare Advantage plan, you could have a 0 premium for your health coverage after that. Medicare supplements, you'll always pay a premium for those, okay? Drug benefits are included in most cases. There are some that are not. Usually veterans will use those because they can get their drugs from the VA. Many plans offer value-added benefits. These are the things that you're currently hearing on TV right now saying Medicare's expanded benefits. vision, dental, and hearing. A lot of these plans have those benefits built right into them for Medicare Advantage plans. Okay, emergency foreign travel coverage is also included in these. Many of these plans will allow you to go to an emergency room anywhere in the world. Okay? Oh, it's going a little quick there. Okay. Enrollment periods. Okay, so for those of you that are just turning 65 or going to be turning 65 soon, you have what they call an initial election period. So it goes for 7 months. It's 3 months before you turn 65, the month you turn 65, and then 3 months after. During that time period, you can enroll into a Medicare supplement or a Medicare Advantage plan. Now, we talked earlier about Medicare supplements having a guaranteed issue. This is that time period. They will not ask you any medical questions at that time. So you can enroll into that plan with guaranteed issue, and you know that you would get that plan. Okay, and now here's another tip for you. If you're looking at age 65 to enroll in Medicare, well, 4 months before your 65th birthday, you want to be looking in the mail. See if you're getting your Medicare card in the mail. Not everybody does. So if you do not, then 3 months before your 65th birthday, you should be on the phone to Social Security, making sure you're in the system, making sure that card is on its way to you. Because what you don't want to be doing is the month you turn 65, scrambling around, making sure that you have that card, because we want to make sure that you get your opportunity to enroll. Okay, annual enrollment period, that's AEP, that's happening right now. That's October 15th through December 7th. That is for primarily the Medicare Advantage plans and the Medicare prescription drug cards. This is the time of year that you can change your plan to a different plan, okay, or you can get a Medicare standalone prescription drug. Now, they added a new enrollment period last year called open enrollment period. So this is it's another layer of protection for you, because if you chose the wrong plan during AEP, which is right now, maybe your doctor wasn't in the plan. Maybe your prescriptions weren't covered the way you thought they were. Maybe the hospital that you wanted wasn't in the plan. Well, now, during January 1 through March 31st, you can switch from one Medicare Advantage plan to another Medicare Advantage plan. Okay, so it's just another layer of protection in the event that you enroll into a program that really isn't working for you. And sometimes your health changes. Sometimes things change. You maybe get new doctors, and the doctors that you want to go to aren't in the plan that you're on. So now you can enroll in a different one. Okay, special election periods. They're also called an SCP. Certain beneficiaries can change their benefits due to a specific life change, such as you move from one state to another state. Maybe you were under your spouse's coverage from an employer plan, and the spouse passed away, and you no longer have that coverage. So there are different situations that will arise where you can enroll during the year if you have a special election. Okay? Lock-in. Those with a Medicare Advantage plan can only change plans during AEP unless they have qualified for a special election period, or during open enrollment, which is OEP, January 1, March 31st. Medicare supplements open enrollment. The 6-month period begins the first day of your 65th birthday month if you are enrolled in Part B. If you apply after this period, there's no guarantees that you'll be accepted, and you may have to undergo medical underwriting. So what they're saying is that if you choose not to enroll during a Medicare supplement plan during your enrollment period, and 2 or 3 years later you go, okay, I want to get it now, you'll have to go through medical underwriting. They'll ask you questions about your health, okay? Each carrier has different ones. And just to give you an example, in order to make sure you're in the right Medicare Advantage plan or Medicare supplement plan, there's a lot of questions we have to ask you. Because just in your area alone, there's 36 different Medicare Advantage plans. There's 30 different Medicare standalone standalone prescription drug cards. There's 25 different Medicare supplements. So how do we know? Well, I'll tell you what, I'll give you the golden rules for picking a Medicare Advantage plan. This may be something you want to write down. When you're looking for a Medicare Advantage plan, you must make sure your doctors are in the network. You must make sure your prescriptions are covered and on the formulary, that your pharmacy is covered through the network, that the places you want to go, hospitals, imaging centers, are all in network. If you do that, then utilizing this plan is going to be much smoother than if you did not do this. And we do this each and every year for our clients. Once you see those, then you can say, okay, what's important to me this year? Maybe I need glasses. Maybe I need some dental work. You know, whatever it is, then we can start tailoring those particular plans to you once we have figured out those questions there. Then lifestyle is important too. Maybe you don't spend your entire time in one location. Maybe you have kids, family members that you're going to go visit for extended period of times. You want to make sure if you're on an Advantage plan that you can use that plan in that area. Okay, so there's a lot of work that goes in behind the scenes here to make sure we get you on the right plan. Okay? Now, this is interesting, star ratings, and I'll tell you the reason why. Star ratings are designated between 1 and 5. Okay, they actually are done in this fashion. Medicare uses information from you, the members, the member satisfaction surveys, the plans, and the providers. So not only you, the people using them, but the providers that are giving you the service all have an opportunity to do a survey and tell the carriers what kind of job that they're doing. Medicare measures how well, how health and prescriptions, drug plans perform on more than 50 key factors. A plan can be rated from 1 to 5 stars. The higher quality plans have a higher star rating. So that's important. When you're looking at a Medicare Advantage plan or a Medicare prescription drug card, you want to look at the star rating because that'll give you an indication of, hey, this plan works pretty well for the people that are using it and the places that take it. Medicare health plans are rated in five different categories: staying healthy, managing chronic conditions, members experience, and customer service. So these are areas that they'll rate these plans and again designate a 1 to 5 rating. Additional information is available at medicare.gov. So Medicare pretty much runs this whole thing when we're doing this. They tell them what can be charged, what is covered. Medicare Advantage plans must cover the same things that Medicare itself covers. It must be as good or better than original Medicare. So there's a lot of information, and we spend a lot of time speaking with you to try to find out what is the best program for you. This is my contact information. There's a lot of different ways that you can reach out to me. Call me. A lot of people like to just call and talk on the phone. That seems to be easiest. You can email me. You can look us up on the web through our website. And by the way, that website, there's a lot of good information there, a lot of helpful tips about senior living, COVID. You look us up on Facebook as well, so there's a lot of different ways to get to us. If you reach out to us on any of those formats, whether it's the phone or Facebook or email, whatever it might be, I can actually send you this presentation. I can send you other information that's helpful for Medicare. I can actually show you and give to you directions on how to go online and set up your account. So there's a lot of different ways that I can help you with this. Been doing this for over 24 years, and as I say, my mother-in-law was my very first client. When she got this book, she needed help, and the system that I utilized to help her find the correct plan for her is the one that I still use today. So if you have any questions, I think we should open up the floor to some questions.
Before you do, I have a couple of online questions.
Sure.
First one is, this one's from Michael, regarding the premium. Is it monthly or annual?
It is monthly. The premiums will be monthly. You can pay them annually if you so choose, but the premiums are monthly.
Second question is it true that Advantage plans may require pre-authorization for some procedures, even if recommended by member doctors, but supplement plans do not?
They could actually both require pre-authorization.
And another question is, in ratings plans, do they share the 50 individual measurements or only by stars?
Only by stars is what I've seen.
All right, so why don't we open up,
Good question.
we'll unmute everyone and allow everyone the chance to ask questions.
How do we hold up our hands?
That'll work.
Dr. Fode, you are on.
All right, the question is, many people here have already Prime issued insurance and are becoming Medicare eligible like me in December. So the question is there any penalty at all if we just get Part A and nothing else? And what do you recommend we do?
No, there is no penalty for that as long as you have credible coverage through your employer, which Prime does offer. What I recommend is this. At that time when you turn 65, before you get Part B, we can do an evaluation to see, A, what's important to you on your health coverage, and see what's better for you. Maybe it's better for you to stay right where you're at with Prime because it covers everything you need. Maybe there's other health concerns that you have and you're looking for different types of coverage or more coverage, and maybe Medicare offers that for you. So you will not get a penalty because you've had credible coverage through your employer. Does that make sense?
That makes sense. The next question is, if you do opt for Part B, how much does that cost usually?
Okay, generally, if you make under right now, under $87,000 a year, Part B is $144.60. That's what it is now. Now, if you file and you make more than that as an individual, then they can increase that. And I can send you those numbers. I don't have the actual numbers in front of me, but I can send those to you. They go all the way up to about $500,000 income. If you make more than that, I believe it's $458 that they can charge you.
Is income based on your tax return?
It is. So when you go into Part B, what they actually look at is 2 years prior. Now, this is important to note too. So let's just say you had a whopping 2018, you made a lot of money. And let's just say for our example here, that they're gonna charge you $200 for Part B. Now you're getting higher and your income's come down. And your income is now in that category of the regular rate. Then what we can do is we can reach out to Medicare and say, hey, my income is no longer that. It's now, between the 7 and the 170. And they can readjust down your Part B premium. Now, that's something we have to make sure we do, though, because sometimes people forget to do that. They just go, okay, this is what my Part B premium is going to be, and they just accept it. So that's why each year we talk to you every year, once you become a client of ours, saying, hey, is this still the right plan for you? Did anything change in your health? Did anything change at all? Well, yeah, Jim. Now I'm making less money than I was then. So now we're going to have to talk through Social Security and get that Part B adjusted down. Good question, though.
I have a question.
Yes.
What is income? Does it include Social Security, pensions, and IRAs?
Yeah, it's everything that's on your tax return, what you claim as income. Any questions about Part A, Part B, what's covered, how it's covered? Was that pretty clear?
Well, I'm going to call you. I know that. But I got another question. There's a noise going on. I don't know what's going on. But we go to a representative, independent guy. My husband's on Medicare, and he has an Advantage plan.
Yeah.
I'm a little confused about if I don't pick the supplement, I pay a penalty for the rest of my life.
Okay. All right, so go ahead.
How do I know if I should pick it or not?
Okay, so are we talking about, so you said your husband's on a Medicare Advantage plan.
Yes,
So are you still working and going to be retiring soon?
yes, in March. I'm
Okay.
65 in March, yeah.
Okay, so if you were to, are you thinking maybe you're gonna stay on an employer plan, or you're gonna just fully retire and no longer be working for the organization?
No, I love my organization. What I have is Cobra because I was laid off.
All right, so here's,
And wait, I'm going to need 1 month of coverage before Medicare.
okay,
Should I go with the hospital plan or just pay for that 1 month? Is it going to hurt me if I stay with Cobra?
well, it's hard for me to answer that without actually seeing the plan, the prices, and how they work, which I'm happy to do that for you. I can look at that. But as far as your question about the penalty, no, you're not gonna get a penalty because you're aging in. You're turning 65. So this is your opportunity to get Medicare and get a plan. So before 65 doesn't really count for Medicare. So it's after age 65. So you're gonna be turning 65 in March, and that's when you're gonna pick a plan, correct?
Right.
So you don't have to worry about a penalty. You won't get a penalty there. As far as, is it better for you to stay on the employer or Cobra, which I think are the same? Cobra, unless it's coming from, your spouse and you're on your employers.
It
I'd
is
have to
my
look-
spouse.
Yeah, I'd have to look at the plans themselves so we could decipher them and see which one makes more sense mathematically.
I don't care about the money. I care more about getting screwed. And
Getting
I'll
through.
pay. I don't care.
okay.
We've been paid. But I want to know if I should get now I'm getting paranoid about the supplement versus advantage plan.
Okay, no need to get paranoid about that because really, here's what you gotta do. Think of it this way. You're still gonna get great quality care because as long as we make sure in a Medicare Advantage plan, the places you wanna go, the doctors and the facilities are all in there, well, I'm sure gonna pick good places to go. So if they're all in there, you'll get good quality care. The difference is gonna be how it's paid for. So here's how you have to think about it. You're gonna pay more money for a Medicare supplement, okay? So you're basically paying up front, if you will. You pay a higher premium, but you get almost no copays, depending on the plan we pick as you go. As where with a Medicare Advantage plan, that's more like a plan you had at work where you pay as you go. So example, maybe you had a $10 copay when you went to the doctor, or a $50 copay when you went to the specialist. Maybe you had a copay when you got an MRI. That's how Medicare Advantage plans work, okay? You have copays as you go. So when we talk to you, we're gonna sit down and ask you a lot of questions, not only about your doctors and medications and places, but lifestyle as well, because that can play a factor into a Medicare supplement or Medicare
That's my
Advantage plan.
question. You turn 65 and all of a sudden you have cancer.
Yep.
And you hear all the time it's not covered. The drugs are not covered. And I'm a nurse. I don't understand how cancer drugs could not be covered. So if your family history has cancer,
Yep.
would it be wise, without a penalty, to get a supplement or the Advantage plan?
Okay, so we're getting into an area where I'm not really supposed to be talking about this on an educational
I
setting.
know.
But,
I know.
what happens is this, those are one of the things that we talk about so we can steer you in the right direction. But what I can tell you is general this, okay? Medicare Advantage plans, you have a 20% co-insurance for chemotherapy. Medicare supplements pay that. Now, I'll have to leave it at that because I can't get involved in particulars about any plan in an educational seminar. But I can certainly get involved with that, with you as we speak one-on-one.
No, I'll call you.
And we can decipher all the plans.
But if I don't, you said if I don't choose the supplement plan, I pay something for the rest of my life.
No, so here, okay.
Hung up on that.
All right, so let's just stop for a second. So let's say you're 65 years old, right?
Yeah.
Turn 65 years old, and let's just say you got a Medicare supplement plan. Now,
Okay.
you have to get a prescription drug card with the Medicare supplement because it doesn't cover that, right?
Yeah.
Okay, so now let's say you're 65 years old, you go, listen, I'm healthy, I'm not taking any drugs, I'm not getting a prescription drug card because I don't want to pay for it. I'm not taking any drugs. Now, 5 years goes by and you're 70 years old and now you're diagnosed with something that requires regular maintenance. And that drug is expensive. So you say, okay, now I'm going to get a prescription drug card. So what Medicare is going to do when you enroll in that drug card, they're going to go, well, wait a minute. This woman didn't have prescription drug coverage from when she was 65, which is when she could have got it, to when she was 70. So now we're going to charge her that penalty. And that penalty is going to be added to the premium of the prescription drug card for the rest of your life. Does that make sense?
Oh, so it's only for the drug?
Oh, no, it could be Part B as well. Again, it really depends on when you enroll in it. And I'll get more involved in that with you on one-on-one for a particular situation.
Do you charge for that visit?
I'm sorry, I can't hear.
Do you charge?
No, I do not charge. I'm here to help you at no obligation, no cost. I do not charge.
Maybe I should talk to your mother.
I'm sorry?
Maybe I should talk to your mother.
Are there any other questions?
Jimmy, it's Michael. Could I ask a question?
Sure.
Sure.
All right. I would like to follow up on the pre-authorization question. Is it possible to find out what the pre-authorization rules are about different advantage and supplement plans? And are there independent ratings or metrics? Because it doesn't matter if your doctor's in network if he or she can't perform the procedures that they think you need.
You could, I would say those are probably in the evidence of coverage on the individual plans that would have those things, and we're going carrier direct. So I can see what I can find for you. If you want to reach out to me and give me a contact information, I'll try to get that to you.
Great, thanks.
Question, if we've not received our card, like I'm turning 65 in December and I've not received my card, just call the local Social Security office?
Yeah, call the Social Security office. You want to start looking 4 months before, okay? Because
Okay,
again,
so I'm less than that, so.
I know, there's no rhyme or reason why not everybody gets it, but some do get it, some don't get it. So
Okay.
that's why I recommend everybody, you're starting to look 4 months out. If it's not there, 3 months you're calling. Now, we used to be able to get Part B in 7 to 10 days. It was that quick. But I had a couple take 68 days just recently. That was probably because of COVID, all right, because everybody was working, displaced working from home. But also you can go right online and apply and see. If you want, again, reach out to me and I can email you some directions on how to do that, set up the account. You can probably do it yourself easy enough, but if you want some help with that direction-wise, I can send that to you.
Okay, thank you.
Yep, my pleasure.
Jimmy, question.
Yes.
I have my appointment today, 2:00 by phone. I did it. So I'm probably going to stay with Prime and Part A. What's my purpose in this phone call? That sounds stupid, but.
No, the purpose of the phone call is that you want to verify everything is correct on there, that they have it in the system, and that at this point, you're going to be opting not to take Part B.
Okay, that'll be no penalty to me.
No penalty to you. Remember, you have credible coverage through your employer. So
Right.
you could work 5 more years and not have Part B. If you want to, okay? And I'm not using that as a time limit. I'm just saying in this example, and not have a penalty. You just got to make sure that you have coverage, credible coverage, while you are not taking Part B.
So I have to ask them if I'm covered for my world tour.
Yeah, covered for your world tour. That's it. Now, when the time comes and you become eligible or you're thinking about, hey, maybe I want to convert to Medicare, then we got to do an analysis. And in that analysis, it takes your current coverage, right? Everything, how it works, what you pay for it, what your deductible is, your co-pays, everything. And we match it up against Medicare. But we also have to add into Medicare that you're paying for Part B. So then we're going to say, okay, mathematically, does it make sense? Or benefit-wise, does it make sense for you to switch over? I've had a number of people switch over because benefit-wise for them, it made sense.
Thank you.
And again, we don't charge you for that,
Okay,
okay? You're welcome.
great, thank you.
Oh, my pleasure. Anyone else?
Thank you.
Thank you.
Thank you.
Thank you. I hope you found this helpful.
Very.
Good. And again, reach out if you have questions. Again, I won't charge you for any of those things. I'm happy to help you.
Thank you so much.
Thank you for
Thank you.
coming or attending.